Hello everyone. Today we're at the Immunity Therapy Center, ITC, and I'm with Dr. Pablo Orozco, who is going to talk about chelation therapy. Doctor, thank you so much for being here with us.
No, thank you for giving me the opportunity to talk about a treatment that I think is very important and not a lot of people know about it. So I think it's crucial.
Excellent. Very sure of that. And well, we're going to start with what is chelation therapy and how does it work?
Chelation treatment is intravenous therapy that we administer here at the center, but it's very, very important to notice that it's very different to a standard treatment. A chelation treatment is going to be used to remove heavy metals from the body. It's very different if you do it through a detox process, that's what we do here, or to treat actual toxicity from minerals. So in this case, we use it intravenously, and how it works, it binds to the minerals, in this case, metals, and it's going to help to eliminate them from the body. But it will depend on how much toxicity the patient has to know the strength of the chelation that we will be using.
Excellent. And what are the conditions or diseases that can be treated or improved with chelation therapy?
There's a lot of information about what can be improved with chelation, heart conditions, for example, especially coronary ones. We also have chelation being used to detoxify the body, which is the full purpose of this. Remember, we're exposed to heavy metals in the water, the food, even the environment. So it's important to do it as a detox process, but chelation is used to remove heavy metal toxicity that is going to be an actual condition. That's the most common treatment or the most common solution. It will be for heavy metal toxicity.
And what are the different types of chelation agents used in therapy, or how do they work?
That's very, very important. So it depends. If the patient has an actual diagnosis, like a specific problem with a heavy metal, let's say lead, mercury, it depends, we're going to use a different chelating agent. The one that we use here, the most common, it's going to be EDTA. That's the one that we use, but it can be changed depending on the patient's condition. So EDTA, that will be the most common that we use.
Great. And okay, and what are the potential benefits of chelation therapy?
The benefits, the patient will see them right away. After we do chelation treatment, the patient starts feeling better. Obviously, if you do a detox program, if you detox the body, you will see improvements. First of all, the patient will start feeling a lot better. It has some things that the patient will experience during chelation. It's a strong treatment, even though it's something to detox the body. Sometimes it's stronger for the patient, but at the end of the day, at the end of the treatment, the patient will start feeling a lot better.
So it's worth it.
Yes, it is.
That's great. And well, actually, the next question is, are there any potential risk or side effects associated with chelation therapy?
Yes, very important. Chelation treatment is a therapy that needs to be done in a hospital. It needs to be provided by a nurse, and it needs to be done with the instructions of a doctor. That's the most important thing of chelation. I mean, any intravenous treatment, it's important to be in a hospital because anything can happen. Allergic reactions, which is not that common, but it can happen. But during chelation treatments, the most common side effect will be problems with electrolytes, especially calcium levels with EDTA. So we always monitorize those things after the chelation is administered. But not only that, we also add to the chelation, the intravenous treatment, we add some elements like calcium, minerals, that they're going to help to get the levels of in this case, the calcium level or even vitamin C to get into a normal range. And it's very important.
Okay, so we should listen to the doctor and follow instructions, right? And how is chelation therapy administered, and what is the treatment process like?
Okay, so to administer it will be intravenous, and the treatment from the patient's point of view, it's very simple. A nurse will administer or install a catheter, and then we will just do an IV. But the backstory of this, the doctor will specify the amount of chelating agents that will be used and pretty much the length or the time that it will be administered. It's crucial to follow those orders. So that's going to be a very simple process for a patient, but on the background for the doctor and for the hospital, it's something very serious that we always take in consideration. Also, previous records of the patient. It's important through the whole process.
Okay. Thank you for that information. And well, I think, how long does each session of chelation therapy typically last, and how many sessions are usually recommended?
Okay. So the time will vary. It could be between 1 hour to even 6 hours. It depends on what we're treating. But usually around 2 hours will be the amount that we usually administer. How many sessions? Usually for detoxing, 2, 3 per week. If it is something specific, like if the patient is here for heavy metal toxicity treatment, it will be at least 3 per week for 3 weeks. That's the amount of time that we need to actually see the changes.
Can chelation therapy be used in conjunction with treatments or medication?
Yes. Most of the time, our patients are going to be receiving chelation treatment alongside other treatments. But if it is only used for heavy metal toxicity, I think that the most common thing to do will be just to do chelation intravenous alone. That's the intravenous route. Obviously, the patient can be taking normal medications, or it could be doing other therapies, but not intravenous. That one needs to be alone.
Okay, excellent. And for last, are there any contradictions or factors that will make a patient ineligible for chelation therapy?
Yes, many. We need to do a complete clinical history prior to doing chelation treatment, just to know that the patient has the conditions. But not only it will be the interview, like the clinical history, we also need to do lab work, because as we talked about before, it can affect the electrolytes. So first of all, the electrolytes of the patient needs to be in a good range, and we need to be alert of possible side effects, heart conditions, things like that. But yes, what's going to make a patient ineligible to the treatment will be basically heart conditions, liver conditions, or kidney problems. That's going to be what can affect the process of chelation.
Excellent. Well, doctor, thank you so much for this information, and it was a pleasure. And thank you so much for joining us in Baja Window to the South.